We are going to discuss about one peculiar condition called Barrett's esophagus. Esophagus is a one which connects our stomach to the external. With that, we eat food. That very important step. The organ in the body, and it also exposed to the acid secrete in the stomach if you don't eat properly and you do unwanted things. Repeated attacks of acid entering the esophagus in long run, it can affect your lower end of esophagus. People ignore it because of that without knowing the consequences. So the hydrochloric acid is secreted in the stomach is very good for digestion. Without hydrochloric acid, the digestion won't be possible. But when you have a excessive hydrochloric acid secretion, so when this hydrochloric acid secreted in the stomach because of your improper eating habit, improper positioning after food, will reflect it affects the lower end of esophagus. In the normal esophagus will have a smooth lining, mucosa lining. Because of repeat acid, you will go for a micro ulceration initially. Then later it may go into this type of Barrett esophagus. Before that, we should know about what is the lower esophageal gastroesophageal sphincter. It is a protective mechanism. It's a one-way valve. It prohibits a gastric juice entering lower of esophagus normally. Because of our wrong attitude toward food and by the severe staining during constipation or lifting weight, this stone of the lower end of esophagus will come down and make the acid reflux and goes into esophagus and produce complications. Initially, patient will have a reflex, will have a retrosternal burning sensation and mouth ulceration, and they will take it as they go to pharmacy and they get this gastric tablets and get away with it without knowing the consequence of this. Normally what they have is a gastroesophageal reflux disease. They don't know the consequences. They just keep on taking the tablet, what antacid tablet in the market. They have it, and they say this because of gas, all this thing. In long run, if we don't give proper treatment for this gastric juice injury, long run, it can affect the lower end of esophagus. This GERD and Barrett esophagus are potential for turning into malignancy. So proper care of this Barrett esophagus is very, 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 very important. So how do you diagnose it? Once a patient says retrostomach pain, I'm having breathlessness, or I've got palpitation, what the simplest technique, they think about heart disease also. So heart disease and the stomach can coexist. This type of reflex patient will have a palpitation and the sweating, right side pain will be there. They mistake it for heart attack. They'll do all the investigations for heart. Then they're normal. Then now the easiest diagnosis for this is endoscopy, painless, simple outpatient procedure. Endoscopy is there. With this endoscopy, we see the mucosa. It is the normal, pale, smooth mucosa that is replaced by velvet color red mucosa. That is all sign of Barrett esophagus. It affects the lower 5 centimeters of the esophagus. When we do biopsy of the test, and we will see whether any plastic changes happening there, and if anything is there, we can treat it with beautiful proton pump inhibitors and effectively 6 weeks, and modification of diet and lifestyle modification, we can completely revert that back. But if you don't do it, ultimately they'll end up in carcinoma of the lower end of the esophagus. So what is the best thing to avoid is eat slowly. Don't eat fast. Avoid spicy masala items. Don't take coffee also. And alcohol is another one which makes this disease to aggravate. So avoiding alcohol, smoking, spicy foods, and oil food, and also taking proper diet at correct time. Homemade foods is better, and avoid the masala items, oil. And another thing, try to avoid eating after 9 p.m. in the night. So normal dinner time is between 6:30 to 7 is the ideal time. If you finish the eating dinner time at the time, definitely you won't get deeper things. Nowadays we see even after 2 o'clock, early morning or 4 o'clock, people are waiting in the shop to get biryani and taking it, and they are vulnerable to develop fatty acid, then the liver issues, then GERD and all those things. Now, of late, the incidence of GERD is on the rise, and also the incidence of if you pick up the patient early, and awareness to the public about the good food items and the good lifestyle and early warning signs of reflux diseases and proper intervention correct time, you can prevent this deadly Barrett esophagus. It is one of the malignant, pre-malignant conditions of the esophagus. If you don't do proper investigation and miss it, definitely you will have this. Nowadays, even for endoscopy, now it is replaced with sponge capsules. String is there. What we have to do, there you get a capsule, will be there. Inside they put a span. They attach to the string. They ask them to patient to swallow it. They swallow and goes in the stomach. The capsule get dissolved. The sponge will be there, and with the sponge you pull out. During on the way, it takes the lower end of esophagus sample. In that you can send it to the laboratory, and under microscope you can see whether there carries any cancer cells. That's one new technique. Those who can't have endoscopy, like those who have a stiff. Nowadays, so many good tablets available in the market. The omeprazole group are very good. In fact, in my clinical practice, I use omeprazole D. I mean, Omis D for the left and right for the patients. But the problem is, we ask them to take it for 6 weeks, but the patient ignore it. They take it for 2-3 days. They stop it without knowing the consequence. So better well inform the patient about the consequence of the hyperacidity, and also if you don't take proper food, what will happen? This thing definitely patient will accept, and the outcome will be there. Quality of life will be better, and the working condition for them will be better, because reflux disease will have a take away that peace of mind. They call nagging one, always retrocerebral pain. You are there, think about heart, they go on keeping changing cardiology, they're doing all ECG, and they say ultimately they come up with Barrett wake away. At that time, it's too late. So early intervention of the reflux diseases and good lifestyle modification and proper treatment with omeprazole group of tablets, suddenly we can prevent this Barrett esophagus from happening, and we can prevent a potential cancer of the esophagus. Thank you.